Hello, everyone. I just wanted to let you know that we are giving other attendees a few more minutes to join the call. So we will start in about 3 more minutes.
Welcome, everybody. Thank you so much for participating on our second webinar. My name is Natalie O'Rourke, and I'm the Executive Director here at Texas Oncology Foundation. I am so grateful to have each of you join us this evening, and I am especially thankful to Jackie Castillo for leading our discussion tonight on navigating the cost of cancer treatment. To give you a little background, the foundation exists to serve patients and their loved ones in the community where they live, work, and receive treatment. And so it's exciting to partner with someone like Cancer Support Communities of North Texas to provide up-to-date information and additional resources for you as a healthcare provider, as a patient, survivor, a caregiver. So I am going to hand this over to Kelly Condon. She is our program coordinator here at the foundation. She's going to review some housekeeping announcements, do an introduction for Jackie, and we will go ahead and start the webinar. Thank you.
Thanks, Natalie. And welcome to everyone who's joining us today. Like Natalie said, I'm just going to go over a few housekeeping things while we are using GoToWebinar. During the webinar, if you have any questions on your control panel, there should be a drop-down section labeled questions, and you can go there and type in any questions, anything from you're having audio or technical issues, which I can immediately respond and help you with. Or if you have any questions for Jackie while she's presenting, you can go ahead and submit those questions in the questions tab. We are not going to stop the presentation to answer questions. We will have a Q&A session after Jackie is done presenting. So just keep your questions coming and we will get to them at the end. If you are experiencing trouble, anything from your windows are disappearing or the slides are not advancing, sometimes the best fix is just to close and reopen the webinar window. Same with audio. If you are experiencing any audio issues, the best solution is to call in instead of listening from your computer. On your control panel, there is an option to select either computer audio or phone call. If you select the phone call, a number will drop down and then you can dial in from your cell phone. Lastly, just so you know, this webinar is being recorded and the online archive will be available for viewing after this live session. And for all of those who are participating, you will receive a follow-up email with the link to this recording. All right, and now I'm going to introduce our speaker, Jackie Castillo. She is with us from Cancer Support Community, North Texas, and she is a cancer research specialist there. I've gotten to talk to her for the past few weeks, and she is just so knowledgeable about the resources available to patients and loved ones, and she does an amazing job of connecting everybody with the appropriate resources. So I'm very excited to hear from her tonight. Jackie, thank you for spending some time with us, and you can take it away.
Thank you, Kelly, and thank you, Natalie. I want to thank Texas Oncology for inviting me today to talk about what I feel is truly a really important discussion that we need to begin and continue to have when dealing with the cost of treatment. So before we get into it, I do want to talk to you about Cancer Support Community North Texas, the organization of which I work for. We are a nonprofit organization, and our mission is to ensure that all people are impacted by cancer are empowered by knowledge, strengthened by action, and sustained by community. What you will find at our 3 DFW area clubhouses is that we provide a wide variety of services that are available not only to the person with cancer, but to the entire family and support system. Our website is listed down at the bottom. I hope you get a chance to check it out, and even better if you get a chance to come and visit the clubhouses. So we're going to go ahead and get started because we have a lot to cover. My goal today my hope is that I get to provide you with a basic understanding of what resources might be available. Financial navigation is unique to your situation. There is no one size fits all. Understanding the resources available will help you to understand what might work for you. So when you're listening to this presentation today, what I want you to think about is what is it, where are you in your treatment, and what is it that might be important for you to understand. It will be different for everybody because everybody's in different stages of their treatment. So you might think it's a little strange that I'm starting off with talking about the medical team when dealing with financial. In addition to your doctors and nurses, it's a good idea to be able to identify who is a part of your medical team. So in each clinic, it may be different professionals, and each one of these professionals may have different roles. But any one of these individuals may help you navigate roadblocks along the way. And the part of the medical team is going to be a good starting point when you do end up having any kind of roadblocks dealing with financial. I always encourage people that before they even begin to do their own research, you start with your medical team, because a lot of times they may have the knowledge and they can cut down on the time of you having to spend to make phone calls. You're going to find at the bottom of the screen that I've actually included family and friends as part of your medical team. I believe that they are extremely beneficial. They are an important part of your medical team that can advocate on your behalf when you're not able to. So in the next few slides, we're going to kind of talk about how they can help you and where they might interact. So when dealing with financial, we always have to start with insurance, because the type of insurance that you have is going to determine exactly how much out of pocket you are going to be out. So understanding how your insurance works is going to be very critical in understanding what you will be responsible for. It's not uncommon when you're newly diagnosed that you may not have a good grasp of everything that insurance does. That's okay. The whole point of this is that you figure out what's important to you and you figure out what you need to learn so that you can advocate for yourself. Most people will think that medical clinics, most of the medical clinics will have someone responsible for submitting your claims. But it's really important that you understand what's happening on the back end so that you can continue to make sure that the insurance that you have is being accessed to the fullest extent. If you do have a good idea to how the insurance works, it will help you in the long run to ensure that you aren't overspending. For those who are visual learners, I've included a link down at the bottom from Consumer Reports that actually helps to explain the basics of insurance and terminology. I've also included a checklist that was created through a partnership with several cancer organizations and checklists to help figure out your potential out-of-pocket costs in a quick cheat sheet. One thing that I always tell people, especially when you are in the middle of open enrollment and you start picking the plans, it's a really good idea to check in with the financial counselors to make sure. The biggest thing is that the clinics and the doctors that you're going to continue to see are going to be in network so that you won't have any more surprise out of network billings. So talking a little bit more about healthcare and the insurance that you have, a lot of times once the claims get started, you start getting a lot of bills, a lot of explanation of benefits from your health insurance provider. And for most of us, we get the bills or we get the explanation of benefits and we set them to the side. Especially when we're not feeling well. But this is a moment where I always tell people that it's very important that you continue to organize it, stay on track, and make sure that you are matching up your explanation of benefits to ensure that your medical bills are as accurate as they can be. When you're dealing with this, I always recommend thinking about figuring out if there might be somebody in your family or support system that can help you to organize your explanation of benefits and your medical bills. A lot of times some of these things are time sensitive and you don't want to leave it until the last minute, because once the timeline expires on some of these issues, we can't go back and we can't change it. So one of the ways that your family can support you, and it doesn't have to be somebody who lives close by, it can be somebody that lives further away, but if they're good at organizing things and they can help you with this would be a good idea to get them assigned so that they can make sure that all the bills are matching up. For the most part, when you're talking about your explanation of benefits, you're dealing with the explanation of what your insurance says you might be responsible for. So when you're getting these, you want to make sure that everything that you did for that day was input correctly. Human beings are putting in medical coding, so you want to make sure that everything is as accurate as possible. The example that I can give when dealing with coding mistakes is if you get admitted into the hospital and they cancel a surgery, but you get billed for it. You obviously don't want to pay something that you haven't had a service for. So it might be a good idea to keep a calendar of all the dates that you're going to the doctor's appointments and what was done. Another example that I can give when trying to ensure for accuracy is, let's say, for example, you go into the clinic and you have your lab work, and the doctor says that your counts are too low, so they're going to cancel surgery. It was already scheduled for it, and when you get your bill, you see that you have lab work that was billed, and you see chemotherapy that was billed. If you didn't have chemotherapy, you want to make sure you go back to the billing department to see if they can correct that change. For the most part, when we talk about appeals and denials, the majority of the time, the medical clinics are going to be helping deal with this. But there are a few situations where you want to be mindful of what the denial was for, and figure out if it's something that you would have to advocate to try to appeal. So in some situations when I'm talking with first-time patients, they get a denial and they think that that's the end. But in reality, you want to make sure that you understand what the appeals process is. You are allowed to appeal any denial with your insurance company, and you want to make sure that you're checking in with your insurance company to see what the actual protocol is. Majority of the insurance companies may ask you to submit a letter in writing indicating that you want to proceed with a appeal process. These are definitely time sensitive, so you want to make sure and keep track of these and communicate with the insurance company as quickly as possible. An example that I can give to you in this case would be if your lab work was sent outside of the clinic where you go to get treatment, and the lab where the blood work was processed is out of network for your insurance company. So if they say it was out of network and you have to pay out of network, or they completely deny it, that was out of your control. You can always appeal it and explain, or have the doctor's office submit a letter explaining why it was important to submit your lab work to this specific agency. I always tell people that even with any denial, it's always good to research, ask questions, and file for an appeal. The majority of the time in the appeals process, a lot of these denials get overturned. So while it is a tedious part of dealing with insurance, this is something that can potentially save you a lot of money if you're getting a lot of denials. For Medicare recipients, there is a specific website to go to, since this is a federal program. I've listed the link on here for you. Definitely same thing for state employees. They have their own link that they can contact, so that if they have any questions in regards to the appeals process. For those who have private insurance, I want to talk briefly about Texas Department of Insurance. They are a state agency that will provide a lot of great information about understanding insurance, understanding your rights. They're a good contact if you think that the insurance company is doing something that they shouldn't be doing. They're a good starting point in figuring out what might be your next step. You also want to think about the other things that the insurance can pay for. Insurance can pay for when you have reached your out-of-pocket max. So things that the insurance can pay for once you've hit that max are going to be durable medical equipment, wigs. Not all insurance companies will pay for wigs, but some do. Home health, physical therapy, occupational therapy, counseling, all of these things are typically, they're going to pay 100% once you hit your out-of-pocket max. So take advantage of your insurance once you have hit that max, so that you're using it to the fullest benefit. In some insurance companies, not all of them may have a case manager, and I always encourage people to ask to see if they do have a case manager to check in with them. So if they do have a case manager, instead of calling in to the regular 1-800 or hotline, you're going to be calling in to a specific person that can help you understand your case and is going to know your situation. So a little bit less stressful than calling the general hotline and having to re-explain your situation over and over. So prescription drugs is something that definitely is going to be very important when understanding which version of insurance you want to pick. Every insurance company decides what tier they want to use when determining prescription drugs. So if you have one plan and you decide to switch to another, and you know that there's a specific drug that might be expensive that you want to make sure it's covered, then it would be a good idea to have to contact the insurance company and see if they can provide you with the formulary chart to see if that drug will be covered. If you go to the pharmacy and you find out that a drug is really expensive, talk to your doctors, talk to the pharmacy tech, explain the situation, explain that it's a lot of money to see what options they have. In some cases, it could be that they might be able to switch it to another drug that works just as well, or they might be able to do a generic version of the same drug. If they're not able to and you need to stay with that same medication, there are some prescription assistance programs that might be able to help. But again, check with your pharmacy technician or check with the doctor to see if they can help you process any of these applications. A lot of times they're going to be requesting paperwork from the doctor's office anyways, so if they can help you with that process, it'll take time away from what you have to do. Medicare has a program called Extra Help. For those who have Part D premiums, it is a program that if you qualify based on income, might be actually be able to help you with the prescriptions. So you always want to make sure that you're checking in and seeing if you do qualify to get enrolled into that program to help you save some extra money. So when we're talking about financial work and health, definitely come up as an important topic. There really is no right or wrong answer when figuring out if continuing to work is right for you. Because there's a lot of factors to consider. There are a lot of different considerations, and it's different for everybody. Some people have to continue to work to pay the bills. So for some people, the insurance is directly tied into their job. So they have to keep working to maintain their insurance. And for others, it's a decision as to whether or not they can physically or mentally be able to continue to work. And in many cases, that doctor might have to make that decision for you depending on the type of treatment. Cancer and Careers and Triage Cancer are two organizations that specifically deal with a lot of these issues. They do an amazing job of going over information related to legalities and dealing with how to work through treatment and how to talk to people like human resources and what legal resources are available to you. So I'd encourage you to check those out and get some information directly from them. I'm going to briefly go over and talk about some of the concerns that may arise when dealing with your job and treatment. With any major decision, I would always encourage you to always talk to your medical team, doctors and financial counselors before you make any major decisions. Because whatever you decide, whether it's to stop working and you're having to figure out insurance, you always want to make sure you're checking in with them to see what kind of repercussions there might be. So with your insurance or with your job, most people will know about Family Medical Leave Act. But what is it? What does it do? And who does it apply to? This is really important to understand because you don't want to make assumptions about what resources and benefits you have before making a quick decision and then later finding out that you don't have these resources. So Family Medical Leave Act is a federal law that applies to companies with 50 or more employees. This is really important to understand because smaller employees or smaller agencies don't necessarily have to offer this. If you do qualify for this program, it is something that will protect your job during a 12-week period where you have to take the time off. A lot of people think that they have to take it all at the same time, but this is actually time that can be taken intermittently if needed. So if you need time off for surgery, you recuperate, go back to work, and then start treatment and take it off when you need to go to doctor's appointment, that is something that you can do. This time may or may not be paid. That'll depend on how much sick time, vacation time you've accrued. Also, another great thing to consider when dealing with, especially with bigger agencies or organizations, you may also want to check in with HR to see what kind of other benefits you might have. With some of the major companies, sometimes they have sick pools where people can donate sick time, and you can use that sick time as if it were yours. So check with the agencies or HR to see what resources you have. You do have to work for the agency or company for a specific period of time before you may qualify for a Family Medical Leave Act, so it's not automatic. So disability is really a big deal that can come up with dealing with cancer, especially if you find that it's continuing to extend the length of time that you have to stay out of work. So I do actually get a lot of questions when we're talking about disability because there's a little bit of confusion. So I want to spend a few slides talking about the difference between Social Security disability, supplemental security income, and then the private insurances with long-term and short-term insurance. So Social Security disability insurance and supplemental security income are two federal programs. So with Social Security disability, you have to qualify based on work credits, meaning that you have to pay into Social Security. For some people, they may not always pay into Social Security. For example, teachers have their own retirement system. They do not contribute into Social Security. So you want to make sure and log on. You can actually go to Social Security Disability, create your own login. You don't have to be applying to enroll into the program. You can go online and you can create your login, and you can actually see if you were to become disabled today, how much income you would potentially be getting. So this is going to be really important, and I always tell people to start with this because this is going to give you an idea of how much income you're going to get. A lot of times it will be a reduction, so it's another question and another consideration that you have to take into account in looking at your budget and seeing what that might look like for you. So when dealing with Social Security disability, they go and ask 5 major questions. And the questions are listed below. So they want to know if you're working. So if you're currently working full-time, more than likely you're not going to qualify because you're working at a full-time pace. If you do have to reduce your hours, the 2018 substantial gainful activity, meaning the amount that you're allowed to work to be considered for disability, for 2018 is $1,180. So you have to be making less than $1,180 for them to consider whether or not you might qualify. They want to know if your condition is severe. So one thing that may come up with this is if you're dealing with neuropathy, if you're not able to do your typing and you do sit-down work, then they have to understand how severe your condition is. For some cancer diagnosis, they do have what's called a list of compassionate allowances. If you actually go to the website and search for compassionate list of allowances, you will find all of the cancers that are listed on there that they would consider as a disabling condition. Typically, if it is on the compassionate list of allowances, they try to speed up the process for you a little bit in trying to process and approve the application. They also want to know if you can do the work that you did previously and if you can do other type of work. So maybe you're doing a very physically demanding job, but you have experience working in the office sector. So they want to know if you can do something different. Can we do that? So all of these are questions that they're going to ask in determining whether or not you qualify. So if you don't have enough work credits, then you can try to apply for what's called the supplemental security income. This is also a federal program, but the criteria for this is similar to the disability, but you also have to qualify based on your income. So Social Security Disability Insurance Program, they don't consider your income, but for supplemental security income, you do have to consider your income, and they do also consider your assets to see if you qualify. For Texas, if you qualify for supplemental security income, typically you will automatically qualify for Medicaid. For disability, if you qualify for disability, you will eventually qualify for Medicare, but typically you will qualify in 24 months or 2 years. Keep in mind with Social Security Disability, if you do get it approved, you will get your first check usually on the 5th or 6th month of the date that they determined you became disabled. So there will be a lag time from when you're approved of when you would get your first check. So if you haven't heard of the Social Security Disability, you probably have heard of long and short-term disability. So a lot of the confusion when I get these phone calls is wondering whether or not, if they're already on short and long-term disability, they're wondering if they have to, if they're able to apply for Social Security Disability. The answer is yes. These programs are actually built to act as a safeguard while you're applying for Social Security Disability so that it allows you to have some lost income. These programs are not everybody is going to have short and long-term disability. Typically, these programs are provided by an employer, or you pay for your own disability insurance through long or short. If you do have short and long-term disability, typically it will pay for 40 and 60% of your income. So yes, it will be a reduction, but at least you will be paid some portion of your income while you're out of work. The criteria definitely is not as strict as Social Security Disability. They typically will ask for documentation from the doctor's office to be able to start the process. So COBRA is something that typically comes up as an issue you have to deal with when and if you separate yourself from your job or if you're terminated. So if your FMLA runs out and you're no longer protected, your job can terminate you. So if they do get to that point, you have to look and see what options are going to be available to you through insurance. So for COBRA, a lot of people know and understand that the premiums can be significantly higher than what you're paying through with regular insurance. You might want to contact HR to figure out what the premiums might be. But before you completely discount COBRA as an option, what you really want to consider and maybe have a conversation with the financial counselors in the clinic about is where you're at as far as your out-of-pocket expense. If you have already hit your out-of-pocket max, it might be to your advantage. It might be cheaper for you to continue with COBRA premiums as opposed to starting over on a different program. These programs, if you do end up moving forward with COBRA, they are time limited. It is between 18 and 36 months. If you do get approved for disability, it does extend, I believe, up to the 36 months. So one thing to keep in mind with COBRA, well, this is a federal law. This law does not, the law applies to private employee group plans with more than 20 or more employees. So again, if you belong to a small business, it's also something to consider because this may not be an option for you. So when dealing with the bulk of looking at where the help is for cancer treatment, I get a lot of questions, where's the money, where's the assistance? The majority of the help when it comes to cancer treatment comes in the form of copay assistance. So copay assistance, there's a variety of agencies. I've listed some of these at the bottom of this slide. They provide qualified patients with help towards the cost of the chemotherapy drugs or specific prescription drugs of cancer treatment. So before you even start Googling any of these agencies, I would urge you to talk to your medical team, financial counselors in the clinic to begin doing before you begin doing the research. Because again, a lot of times these agencies are going to require medical documentation anyways. So if they can help you navigate that, it would be easier for you. They do base it on income. And a lot of times when I'm having conversations with people, they may say, well, Jackie, I'm not going to qualify, I'm working. I always tell people to still have a conversation with the clinics. The majority of these copay assistance companies offer their income guidelines a lot higher than any other regular assistance programs. Most of these programs will offer it at 400 to 500% of the federal poverty guidelines. So you'd be surprised, actually quite a few people will qualify for the medicine and the help. So I also want to talk about some of the additional resources. And this is typically where I have a lot more conversations with people about. So there may be some potential that you can apply for some grants to help offset medical expenses, such as rent, mortgage, gas cards, and groceries. Because we all know that you still have to continue to pay the bills in addition to all the medical expenses that you're accruing. So if we can help to offset the medical expenses, then we want to make sure and talk about this and see if it's something that you're accessing. With these agencies, I want to make sure that you understand that you are applying for them especially when you're in treatment. A lot of these programs are, while they may be national programs, these programs are a lot smaller than the copay assistance programs. Typically, when you get funding for copay assistance, it can range anywhere from $1,000 upwards of $5,000. With the grants to offset the medical expenses, they could be anywhere from $50 to $1,000. With the copay assistance, you may be able to apply yearly. With grants, some of these are going to be once that you're able to apply for them or once a year, depending on the agencies. Keep in mind that with these grants and these organizations, typically they are also nonprofits. They typically are smaller agencies that are started by a lot of people just as yourself, a lot of people that have experienced cancer and want to help others because they realize that it was a struggle for them. So their funding really does depend on how much they can raise throughout the community. So before you begin doing the search, again, I would urge you to talk to a social worker or a navigator. While you can get the list of resources, what you want to make sure, because the social workers and navigators are doing a daily task of checking in with these agencies, they may know which ones are shut down, they may know which ones have a deadline, and they may know what's helped for somebody else in the past. And maybe they can write a letter on your behalf that can help you to process that application. So always start with these two people to see if they can help you process the claims or process the grants. A lot of these grants that I have found are based online. So obviously, if you don't have access to a computer, definitely you want to make sure that you're talking with a social worker or a navigator to see if they can help you complete these applications. If you are going to do the searches, I would suggest that you maybe start with needy meds. You can go onto their website and actually search by the diagnosis. And if there are any kind of resources, it would list them on there. There are some other agencies that can actually help you start gathering a list of resources that help with offsetting these medical expenses. American Cancer Society does a good job of listing some of the resources that are available nationally. I would also suggest that you go to cancer-specific websites. For example, Patient Resource and Cure Today. You can actually have information sent electronically specific to the type of cancer you have. Patient Resources sends magazines out to your home, where in the booklet it will actually list some resources and financial information that may be available to you. I would also encourage that if you are going to sign up for some of these agencies, also get registered on their informational or emails. This is especially true of healthcare providers. I do this all the time. I register for any and all kind of webinars or services that are happening, and I get emails constantly of anything coming up, anything that's new, whether that be medication, whether that be FDA approvals, or maybe a specific agency that has started. I like Cure Today because it actually does blogs of personal patients, and they actually, in their blogs, sometimes talk about some of the things that have helped them for financial assistance. So, a lot of times, some people may not necessarily think of lodging and travel as something that is related to your medical out-of-pocket expenses, but I would encourage you to take a look at this, especially if you're traveling an extremely long distance to come to your treatment facilities. Check with your insurance to see if they pay for travel or lodging. You never know, especially if you have extra or supplemental plans, whether or not they offer these. So you always want to make sure that you are reaping the benefits of the insurance. If you are having to commute via air, a great resource is through National Patient Travel Center. They can help you figure out which agency, whether that be a commercial airline or a private jet, might be able to help you coordinate get there. With this option, I would definitely encourage you to communicate with them at least 3 weeks before to see if they can get you some kind of an arrangement. For the lodging, American Cancer Society offers the Hope's Lodge program where they can try to get you into their own facilities. If they don't have their own facilities where you're getting your treatment, you may also still call them, because sometimes they partner with area hotels to be able to offer you lower discounts, or sometimes, if they're able to, free hotel stays. Joe's House is a great starting point if you're looking to stay nearby a hospital, especially if your families come in. Sometimes they can offer you discounts, codes when you're calling in that you can use specific to any major hotel company. And then obviously Ronald McDonald House Charities is for the kids who are coming to treatment from out of town. With this, I am going to stress that you also communicate with your social worker or nurse navigator. There are a variety of other resources for lodging and travel that I did not list, but because some of these agencies request that they only get contact from social workers. So it's not something that's going to be necessarily public knowledge, or maybe it's a specific program that's working with one area hospital. That social worker is going to know about those resources and can try to work on getting you on the list if possible. So crowdfunding is something that has become a lot more popular, and definitely something that I want to cover as an option for possible online fundraising. But I do want to caution you, especially if you are a family or a caregiver, before you start this, you definitely want to make sure that the patient is comfortable with this, because you are putting private information on the internet. And once it's on the internet, it's on the internet. Assume that it's on the internet forever. So, and then obviously you're sharing a lot of medical information. So make sure that it's okay with the patient to start this process. There are a lot of fundraising websites. I've listed a couple of them here. And I want you to make sure that if you are going to move forward with this, that you check on the back end how much each agency will charge for their fees. There are fees to every one of these agencies, so you get to pick which one might be the best fit for you. Sometimes you don't necessarily think about some of the state resources that you may qualify for, but you always want to inquire, even if you're not sure, if you think that you never qualified, you never know. There may be some programs that you may now qualify for, especially if you've lost or reduced your income because of the medical illness. So you always want to check to see if you can apply for any of these services. You definitely want to make sure and keep track of any and all medical tax deductions, and that includes anything out of pocket that you're having to pay for medical reasons, parking, lodging, air travel. You want to make sure to save all of this, and at the end of the year, when you're meeting with your tax consultant, have them go over all of the information and out of pocket that you spend to see if you can use the medical towards your tax deductions. You also want to make sure and check in with county resources. This is something that a lot of people may not know about. I know that the bigger the county that you live in, the more possibility that there might be some resources available, specifically to those who have to stop working due to medical illness. While some of these resources may be temporary, you definitely want to take advantage of them if you're able to qualify and apply for them. And I list this as a last resort. Definitely, you can always look into how much, what kind of pros and cons it would be to trying to access your savings or any kind of 401k if you truly needed to. Definitely, I always urge you to talk to a financial counselor before you even take any money out of savings or 401k, and always ask them about how it would be different for taking money out because of a medical hardship. One of the things that I didn't include on here that you also may want to consider is if you have any kind of student loans. Those are loans that typically they may be a little bit more willing to work with you as far as putting into deferment if you need to. If you become disabled through Social Security disability, student loans are something that you can communicate with your company to see if they can forgive your loan or if they can reduce it in any way. So I've listed some of the references on here for your benefit that you can access that I talked about in the presentation today. And I've also listed my information, my email address. If you have any questions that perhaps I can't answer today, you're always welcome to reach out to me for a free assessment and we can discuss your case individually. I think that is it.
Awesome. Thank you so much, Jackie. There were just a few questions that came in, so we can ask those and step into our Q&A time. But like Jackie said, if you do have any specific individual case questions, she has provided her contact information for you. All right, Jackie, the first question was, have you had any success deferring your mortgage payment during the duration of treatment?
So that's a really great question. I would always tell people to try it. It depends on the mortgage companies. Not all of them are willing to do it, but sometimes they may be able to do a deferral for a month. You may still ask them, because I have heard some of the people that I've worked with in the past, some of them have told me that the insurance or the mortgage company has actually had some kind of an insurance plan where they paid for a month. So you always want to make sure and check. If you don't ask, you're not going to know.
Awesome. And then going back to when you were discussing disability, do you recommend for families to go ahead and apply for both Social Security disability insurance and the supplemental security income? I guess, is it possible for them to be approved for multiple?
That's another great question. So when you're applying for Social Security disability, if you don't qualify, typically Social Security will automatically look to see if you qualify for supplemental. You cannot be approved for both. You're going to be approved for either or neither. But it's a great question. So, and one of the things that I forgot to mention is communicate these questions with your doctor. If you foresee that you're expected to be out of work for a year or longer, you do not have to wait a full year before you apply. Start applying the minute that the doctor tells you that he or she thinks that you would be eligible, or if you're expected to be out of work for a year or longer.
Okay. We just got more questions in, which is so exciting. So Mr. Rogers is asking, what is the normal lifetime maximum dollar amount allowed for private insurance?
So that is going to be different with every individual insurance company, and that's something that you're going to have to contact your insurance company about. I believe, if I'm not mistaken, Medicare might have some lifetime maximums on certain things, for example, like going into nursing homes or rehabs, but you really need to check directly with your insurance company. If you're having trouble finding that information, give me a call and we can try to make some phone calls together and see if we can help you find that information. I would tell you that to my knowledge, most public or private insurance agencies typically, from what I've seen, don't have a lifetime maximum anymore. That's one of the things that the Affordable Health Care Law did away with a lot of the insurance companies.
Okay. And then we got another question asking about if you had any advice for small business owners. They said they have had to close their doors, but the normal household expenses plus the loans we have received on business are still ongoing. Income is down to zero. So I guess any advice you would have for a small business owner?
As far as dealing with the cost of cancer treatment, if he is a small business owner?
That's what it sounds like.
Okay, so I guess if one thing that I would always tell people to start with is looking at your financials and establishing a budget and figuring out where you're at. Again, it is different for everybody, even because I talk to people who have small businesses all the time, and it really just depends on what assets do you have, what county do you live in, because that will depend on what resources might be available as to how you figure out how to proceed. So definitely that might be a question that we can communicate offline.
Awesome. Well, those are all the questions that we have had come in during this time. Thank you again, Jackie, for spending an hour with us. Like I said earlier, I'm so happy to have gotten the opportunity to listen and just learn more about the resources available.
Yeah, Kelly, one other thing that I will tell you, I will be doing more as a lot of these similar presentations at the Area 3 clubhouses. So feel free to log on to the Cancer Support Texas to take a look at the calendars, or shoot me an email to see when I might be doing them so that you can be aware, because those are going to be open to the public. The other thing that I want to mention to everybody is I am starting to write monthly blogs. And the blogs have to do with a lot of different resources that you may not even think about. Anything from transportation to camps that you can go to that are free. So if you're interested in that blog, definitely send me an email and I'll be happy to add you to the monthly blog email list.
Very good. Thank you so much. To bring this webinar to a close, on your screen, a survey will open up. Please just take a moment and provide us with feedback on today's presentation, as well as topics you'd like to see covered in future webinars. We hope that you enjoyed this. Texas Oncology Foundation has started launching this webinar series, and we will be continuing it once a month. Our upcoming webinar is now February 8th. And Tamika Felder will be joining us and discussing intimacy after cancer. So we are excited for her to join us next month. Thank you again, Jackie, and thank you to everyone who took time out of their evening to listen in.
Well.